Our project focuses on Sierra Leone. My name is Sharmita Dixit.
My name's Bailey Borkowski.
My name's Allie Hurst.
My name's Dominique Palmer.
My name's Emil Usinger.
Sierra Leone has some of the highest maternal, newborn, and child mortality rates in the world. The maternal mortality ratio is 1,165 per 10,000 live births. The neonatal mortality rate is 39 per 1,000 live births. Mortality for children under the age of 5 is 156 per 1,000 births. And the adolescent birth rate is 125.1 per 1,000 women aged 15 to 19. The four leading causes of death in maternal mothers are obstetric hemorrhage, obstructed labor, hypertension, and sepsis. Major causes of death in children under the age of 5 are diarrhea, neonatal pneumonia, malaria, and injuries. Adolescents aged 15 to 19 contribute to 25% of the total maternal deaths in Sierra Leone. And 74.3% of women between the ages of 15 and 19 have testified that they have faced female genital mutilation. Nutrition: 8.8 of children under 5 are overweight. There is a 37.8% prevalence of stunting in children under the age of 5. The prevalence of wasting in children under the age of 5 is 9.5%. 13.3% of women in Sierra Leone suffer from obesity, whereas 3.8% of men suffer obesity in the same country. 47.2% of babies under 6 months are breastfed exclusively.
So the most pressing communicable disease in Sierra Leone is malaria. The entire population is at risk, but the government's actually had a great success battling it so far. In 2017, the National Malaria Control Program launched a bed netting program supported by UNICEF and WHO. They achieved that 95% of households had bed netting, and they really tried to focus on the intermittent prevention and treatment of infants. And they also had a highly effective program for this. And one of the benefits they had is that there's no mutant strains of malaria in Sierra Leone, so they're not trying to battle with drug resistance. The next illness that I looked at in Sierra Leone was diarrheal illnesses, and it's the 4th highest cause of death and disability. However, the government doesn't have an active program to battle it, and they're spending more of their time focusing on malaria, HIV and AIDS, and TB. So moving on to HIV and AIDS, the largest fight against it right now is the social stigma. So they actually have available tests, and they're trying to raise awareness and have free education for it. It has a 1.5% prevalence, and they're getting about 2,000 new HIV cases reported per year. And then their big goal for this was to have all district managers trained on it, and it actually went really well, and 4 of the districts have local level personnel that are trained for HIV prevention. And then next disease I looked at was TB, and Sierra Leone actually has one of the highest TB burdens per capita in the world. They have about 22,000 cases per year, and there is available free treatment. However, only 6 out of 10 cases are identified, so they're having a hard time diagnosing the disease. And their very significant step for TB recently was having the first drug-resistant treatment center built in Sierra Leone. And this is a big step for them because they're finally starting to see the drug-resistant strains in TB, and now people that need this care can go there and finally get the multi-step drug treatments. And then the last thing I looked at in Sierra Leone was the neglected tropical diseases, and they've actually had success treating these with mass drug distributions, and 80 to 96.5% of districts are seeing a very high effectiveness rate in this, and they don't have as many going on right now because of the mass drug distribution, so they're just doing like a lot of surveillance programs to prevent it.
Non-communicable diseases represent an increasingly significant disease burden in Sierra Leone, as evidenced by WHO reports. Deaths related to NCDs were 18% in 2008 and have increased to 26% in 2012, with cardiovascular diseases accounting for 9%. Furthermore, around 30% of men and women had high blood pressure. 33% of men and 6% of women smoked every day. 9% and 28% of adults were estimated to be obese and overweight, respectively. In general, low priority has been given to NCD control and prevention in Sierra Leone due to several factors. Foremost, the health systems remain fragile, especially post-Civil War and post-Ebola, as well as under-resourced, limiting the creation of an effective response to the growing burden of NCDs. Moreover, international attention and funding did not focus on non-communicable diseases as much as there was focus on maternal health and communicable diseases. There was also limited political commitment and strong leadership focus towards NCD prevention activities. Sierra Leoneans have adopted Western lifestyles, and urbanization has contributed to even more unhealthier lifestyles. Smoking and alcohol use are very common, while shisha smoking among adolescents and adults has increased recently. Sedentary lifestyles are an important risk factor as community perceptions discourage active physical exercise. Additionally, some residents perceive hypertension as a result of too much blood in the system, while diabetes is caused by just too much sugar. Quite often, patients do not recognize or become willing to accept their disease condition. Lack of awareness often worsens disease conditions and delays access to care. For minor symptoms, people typically self-refer to herbalists and traditional medicine vendors, only seeking formal care when major complications arise. Due to these reasons, diabetes and hypertension have been on the rise. Referral systems for management of chronic disease are also weak, especially at the primary care level. Referral systems identify individuals affected by NCDs and then direct them properly to a more specialized secondary or tertiary care system. There is also a recording and follow-up of patient care involved. Access to palliative care is a problem in Sierra Leone as well. The lack of medicines in public facilities is one of the biggest obstacles to the delivery of NCD services, motivating patients to purchase medications from private pharmacies or informal sources, which often sell poor quality medicines. Physical access, such as transportation, is an issue, as noted specifically in Bombali, which is a northern province of Sierra Leone. Their long rainy season also makes many roads hard to travel. These barriers to care delivery are aggravated by poverty from the community side, implying that overall neither the health system nor the community is in a good position to address non-communicable diseases.
The environmental issues that Sierra Leone is currently facing are deforestation, fragmentation, degradation, low soil fertility, loss of biodiversity, air pollution, and water pollution. These issues have not been fully realized in Sierra Leone, so there's not a deep understanding of the problem or how to fix it. The government and Ministry of Lands, Country Planning, and Environment have created some policies to restore the environment, but the rate of development is not matching their loss. One major environmental problem directly affecting the health is the water pollution. Mining companies use toxic chemicals which find their way into bodies of water that Sierra Leoneans drink. The water is also polluted by human waste and carries many diseases. This also affects the wildlife, another reason for their loss of biodiversity along with their loss of habitat. The people of Sierra Leone acquire their essential nutrients such as proteins, vitamins, and carbs from these animals that are being driven away. All of these environmental problems make it very difficult for the country to become more industrialized and be able to deal with these problems properly. Their focus is on the most pressing issues such as communicable and non-communicable diseases since their health systems are lacking. The impoverished community is specifically at risk because of the resources they have available to them. They're the ones left to deal with this burden of disease caused by the environment when the government cannot progress. The mortality rate per year for air pollution is 1.3 million. Mudslides leave thousands homeless and hundreds dead. A cholera epidemic in 2012 was caused by unsafe drinking water. The prevalence of chronic respiratory disease is on the rise, and lower respiratory infections is the second highest cause of death in the country, followed by protein deficiency and diarrheal disease. The WHO and Global Health Initiative are working with the country to improve their health standing by providing essential health services, but ultimately the government is not doing enough to help prevent these illnesses by improving their environment.
Natural disasters are a huge problem in Sierra Leone, which faces threats of flooding and landslides, resulting in the displacement of over 11,000 people per year. 2017 was especially bad due to a landslide in August that resulted in the deaths of 1,141 people and leaving another 5,000 people homeless. The high death toll was partially due to the unsafe development and deforestation on mountainsides that is unregulated in Sierra Leone. The government's lack of preparedness to disperse aid outside of immediate relief was demonstrated during this emergency, as many of the survivors have yet to receive compensation for the disaster or any assistance past the first few days following the disaster. This lack of preparedness is partially a result of a continued crises that plague the country, such as the Ebola outbreak in 2014. The country has also still not fully recovered from the civil war that lasted from 1991 to 2002. During this period, the rebel forces, as well as the state forces to a lesser extent, committed extensive human rights violations targeted at civilians. These violations included the systematic rape of young girls, mutilation of arms or legs, and the burning of entire villages with residents trapped inside. This resulted in the deaths of over 50,000 civilians and displacement of over 1 million more. Of this 1 million, only 220,000 were registered officially as displaced persons, and thus 750,000 people were assumed to have returned to their homes or settled in a new community, but only those who were officially registered as IDPs received any aid or compensation. Currently, around 3,000 people are still displaced every year due to conflict and violence, and camps to house displaced persons often provide only the most basic care and suffer from lack of essential needs such as water and shelter. Tents are provided to individual families, which reduces the risk of sexual abuse, but there's still many complications. There are also 13,000 refugees from Sierra Leone abroad, mostly living in nearby countries Liberia and Guinea. This number is much smaller compared to 80,000 refugees at the end of the Civil War, many of whom were repatriated to the country. Thank you for watching our presentation.